Hi, I am Dr. Tinglestone, but you can call me Stormy, and today I will be conducting your cranial nerve examination, specifically related to cranial nerves 2, 3, 4, and 6, which are the cranial nerves that are related to the eyes. So I will be testing your vision, your peripheral view, the range of motion. In fact, we will be focusing on the ocular cranial nerves, the oculomotor cranial nerves, which, along with the trochlear and the abducens cranial nerves, are responsible for the eye movement. And today we're going to take care of that very thoroughly, okay? Are you excited? It's gonna be fantastic. Just relax and let me do the work. So the first thing that I would like to do is to have you get used to the light, because I want to test your consensual and direct response of your pupils. So how they dilate quickly, slowly, properly when being stimulated by the light. Okay, before I go ahead with that though, I'm just gonna get you used to the presence of something bright into your visual field. So I'm switching this light on. I am not asking you to look at the light, okay? So I'm gonna switch it on in 3, 2, 1. There we go. I'm just gonna move it into your visual field, but please do not look at it, as you will not have to look at the light for the entire pupillary test. I just want you to get comfortable with the presence of something bright close to your eyeballs, but that doesn't mean that you have to look at it at all for the time being. So we just warm up your vision here. How is that feeling? Would you feel ready to start the direct consensual response? Okay, so to do so, I'm gonna use this eye closer right here. I'm going to close one of your eyes with it, and I'm gonna be flashing the light into the other eye. Again, the light is gonna be very close to you, so please don't look at it. You can find a spot anywhere behind me or my ear, my nose, whatever feels best for you, and just focus on that as I move the light into your visual field. Is that okay for you? Great, so we're getting started. Very good. How is that feeling? Wonderful, the dilation is happening properly here. So I'm gonna have a look at the other eye as well to see if we have the same response. Okay, so I'm gonna close this eye now, and I'm gonna flash the light into the other. Again, don't look directly. Don't have a good response here. So now I'm going to split your visual field into two halves and have a look at the consensual response, which means that I'm going to flash the light into one eye, but having a look at the reaction of the other, expecting for the other pupil to dilate as well, even if not directly stimulated by the light, okay? So let's start here. Again, don't look directly at the light. Good. Let's move to the other side. Same thing, okay? Splitting your visual field into two halves. Please don't look directly at the light. There we go. Perfect. I do see a proper response to the light in terms of dilation, speed, and amplitude, which is great. So we can move on to the next test. Now I want to focus on the motion of your eyes. So this time you're gonna have to follow the light, okay? Okay, we're starting slow. And then we're picking up the pace. Back to slow, keep following the line. Pick up the pace again. Just follow the light to the best of your abilities. Very good. Wonderful. Now instead, I'm going to cover your eyes, okay? And as soon as I uncover, I'm gonna be placing the light at random positions. I'm gonna need you to find it, okay? Okay. Find the light. Very good. Wonderful. Now I'm just gonna ask you to follow the light as it comes closer and it goes farther away. Good. Just one eye. Very good. Now I want to check your peripheral view, and I'm still going to use the light for this first part of the check. So I'm going to ask you to look at my nose and tell me when you no longer see it. Okay, good. Now we take a break from the light. I still want to check your vision, so I'm gonna have you focusing on my nose and tell me when you no longer see my fingers, okay? Wonderful. Now I'm going to bring back the light, okay? I need you to stare at my nose. I'm going to make the light pass into your visual field. And one more time, keep looking at my nose. Okay, could you tell me if the brightness of the light was the same in each eye as it was crossing your visual field, and if there was any difference, could you quantify it with a percentage? Okay, so same on both eyes. Good, that's what I wanted to hear for the brightness saturation test. We're gonna do the same thing with the redness saturation test. So again, I'm gonna have you focusing on my nose here, and I'm going to run the red tool in your visual field, and then we're coming back. Good. Could you tell me if the amount of redness that you perceived was the same for both eyes? And if not, could you give me a percentage? Okay, so same on both eyes. Great to hear. I now want to test your vision. So there are two cardboards over there. Can you read the white one? Can you read the second line? Okay. Can you read the third line? Okay. What else can you read? Really focus. Okay. How about the red and green one? Can you read the first line? And can you read the second line? Do you have a better time reading on the red portion or on the green portion? Or is there any difference at all? Great. Now I would like to have a look at your eyes from more up close, to have a look at the vascularization and the mobility of your eyes. So I'm going to gently spread your lids open, very gently, I promise. And with my otoscope, which does not make a very bright light, I'm just gonna check from real up close. I'm also going to give you a couple directions that I'm gonna need you to follow, okay? Okay, good. Can we get started? Alright, let's start with the left eye. I'm going to gently spread it open. Is it okay? Good, so I'm coming closer. Firstly, having a look at the lubrication and vascularization of the eye. If there is any abnormal redness whatsoever, and everything is looking fine. Okay, I'm giving you a quick break. You can blink and reset. And I'm gonna do the same thing on the other eye. Okay? Spreading open. Having a look. Okay. Vascularization and lubrication of the eye. How is the feeling? Okay. And blink and reset. All good? Okay. Do you spend a lot of time at the screen? Because your eyes do look a little bit dry. Yeah, nothing alarming. Is something we can easily fix with some hyaluronic acid based drops. Okay? Okay, so now I'm gonna ask you to follow my instructions, okay? So we're gonna go back to the left eye, and I'm gonna go back to spreading it open. Of course, if you need any extra time, any moment to blink, you want me to stop, tell me at any time. Give me a visual cue, such as raising your hand if you don't feel like talking. But please don't hesitate to let me know, okay? Okay, so gently opening. Alright, very good. I need you to look up. Look down. Look left. Look right. Look up left. Look up right. Look down left. Look down right. Blink, 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 blink. And we repeat this one more time. Gently spreading open. Look down. Look up. Look left. Look right. Look down up. Look up right. Look up left. Look down right. Look down right. Go in a circle towards clockwise. Circle counterclockwise. Good, and blink. Wonderful. Everything is working nice. Okay, we're gonna do the same thing with the other eye, okay? Opening up gently. Look up. Look down. Look left. Look right. Look up right. Look up left. Look down right. Look down left. Blink, 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 blink. Okay, good. We repeat. Opening up gently. Look up. Look down. Look left. Look right. Up right. Up left. Down right. Down left. Move clockwise and circle. Counterclockwise. Very good, and blink. Wonderful job. I just want to listen to the pressure of your eyeballs to make sure that there is no glaucoma whatsoever, okay? So I'm going to use my stethoscope. I'm just going to gently place it please close your eyes. Okay, gently placing it onto your eyelid. Good. Other eyelid. Good. All good here. Very good, very relieving. Lastly, I'm going to use this blackboard. I'm going to be tracing some lines and circles on it. Lines, circles. And I need you to tell me, when am I drawing a line? When am I drawing a circle? How many lines? How many circles? All of that, okay? Good. Mm-hmm. 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 Very good. Your exam went really well. Your eyes are perfectly fine. And I'm very glad to communicate to you that you are in perfect health with your cranial nerves. Thank you so much for allowing me to perform this exam on you today. I hope you